Hi, I'm Art Bailey, and this is the IMT Lower Extremity Level 2. Now, what's different about Level 2 than Level 1? Level 1 originally, as you may have been in one of those classes, was a lot of ammunition, great ammunition. The feedback was, Art, good ammunition, not quite sure how to use those tools. Can you give me something a little more specific? So what we have here is a regiment that is more like a recipe, similar to other people's structural recipes, that takes you from one point to the other point. You can take a person in low back pain, discomfort, take them through this recipe, and be pretty sure they're going to get a lot of relief. So we took a lot of the ammunition from the first course and incorporated it into this second level, along with some newer information. As we've learned a little bit, we want to impart that onto you. So we'll start out first, considering that we may have a low back pain. And I'd like to thank Lisa, our model today, and we will try not to be too rough on her. For low back pain, one of the first things that you want to make sure is this something that I can deal with. Often you can do a straight leg test on someone that has low back pain and it will fail, and that means you should send them out to be checked on. But one thing you can do is positional release, and if it is just a muscle causing that dural tube compression in the spine, then it will ease up and you'll know once you've done the positional release for low back. The positional release for low back will be helped if you add a little bit of heat. First thing I would do is I would take something like a wet hot rag or microwave something that I have and place it under the low back to affect it with heat. Then I would take the legs on this particular slope bolster. I would also place some heat in the front margin, right here around the crest. And I use these hot stones to do that. You can take low bottles, doesn't matter. But once you have them in position, and often you put them directly on the tissue, and this heat will reflex basically the psoas, what you're trying to work on. You bring both legs up, you bolster the legs, you cross them, slightly open them, and this is the release position for your psoas. You will also work the costa margin here inward, and that will reflex the viscera and settle down that muscle with what's called a viscerosomatic reflex. And you keep the person in this position for about 10 minutes, something like that. If their legs are heavy, you just push back and hold on them. If it hurts more on one side than the other, move until you outrun the pain. For instance, they say it's on this side, simply flex the legs in this position until there's no pain. The key to positional release, you have to remember, is no pain. You're turning the muscle off. After you've done that, sufficiently, at least 10 minutes, bring the legs down very slow, and how slow you come out of it dictates if that muscle turns right back on. And then you can do some of your same testing and see if, in fact, there's been a reduction in low back pain. If there has, then you can go on with the rest of this recipe. If there hasn't, then you do a straight leg test and you can get the same failure, then refer this person out. So, that's prior to doing anything, is reset and test the low back. Next thing we want to do then is incorporate a little bit of postural correction into this lower extremity course. And to do that, we're going to do a very specific levering system on the shoulders. I take a towel like this, which is just a regular bath towel, put a karate belt in it. You can put cardboard, doesn't matter what. But what you're going to do is place this under the shoulder blades, and the tip of the shoulder blade is going to go right through the center of this bolster. And what that will do, it's going to facilitate the scapula going back and out. And that's going to give you that opening in the front plane of the body. At the same time, we're working the lower extremity. Then a little bit of tension in the upper extremity is going to cause some of that forward head shoulder to correct itself. So, we'll place her in that position. I'm going to reach here and find the tip of the shoulder blade just like that. Place her back. And this pillow is just a little travel pillow. Notice that it doesn't go all the way out like a regular big pillow. And the reason for that is I'd like her to place her arms up here. If at any time this is too uncomfortable, you can bring your arms down. But what this is going to do now is traction the entire upper part of the torso. We'll then use our leg bolster again, and we'll start out first by reflexing the costal margin and lengthening the front plane of the body. And we call this the front plane. And that plane of fascia goes all the way from the foot, comes up to the pubic bone, through the ASIS, to the rectus abdominis, to the sternalis, into the SCMs, and basically makes you feel like you're just being pulled down. So to reflex this costal margin a little bit, we simply place the tissue over our hands instead of digging underneath there to affect the diaphragm. And we can do that to both sides. Now, at least we're just going to do most of the work on one side today so that we can cut our taping time down some. Remember that you do this to both sides of the body. And then just reach in around the ASIS here and pull all the tissue toward the center. And do this all the way around. Come around to the other side, do the same thing from that side normally, and pick up the rectus abdominis. And lengthening this gives some release to the back. Once we've done this, then we want to do a crucial thing. That is set the pubic symphysis. Now this pubic symphysis has a cartilage that attaches the two halves of the innominate here. Half your hip is called an innominate, and often because of muscle tensions, it pulls one higher than the other. And the person will come in saying, I've got a pain wrapping around my back, hip, all the way down into my groin. And that's very positive for a shifted pubic symphysis. To bring it back into alignment, we're not doing any chiropractic. We're just going to make that ligament relax. And to do that, I'll bring the heels together, ask her to close her legs for me, and then I just apply pressure. And often you'll get a clicking sound if that symphysis is out of alignment. Once we've done that, we'd like to stabilize some of the flexors, being the psoas and pectineus. Pectineus is actually classified an adductor, but it is a strong flexor in the way it works in pulling the hip anteriorly, so we want to loosen it and this psoas. To do the psoas, we bring the foot down and we ask her to press down on the foot. At the same time, she's going to push her knee over the foot, and I'm going to help this. So I'm going to reach in here right around the crest, always marking the ASIS. Find the psoas, push your knee against my hand slightly, there you go. And it feels kind of like a rope, as they say, a slick rope. It's good. And then I'm going to ask her to push her knee over her foot, and that's going to elevate her hip slightly. I'm going to pin the psoas and pull, and back down, nice and slow, and again. You can reach the medial fibers of the psoas with this movement, so it's a nice low stretch for it. Then I'm going to do a standard pin and stretch for psoas pectineus. I'm going to reach right here, holding the psoas in my hand, and dial it into place, moving the leg. What you often feel is a popping sensation where it crosses the hip. And if you come down a little bit further to find the pectineus, basically you ask them to engage with you. Once you find the adductor longus, go down the medial aspect of the leg until you hit the adductor longus. From there, you can just follow it in. Ask them to bring your leg up and inward slightly, and there's a pectineus that will pop up in your hand. Once you have that, forms a little pocket, hit it, and mobilize the legs. This is called a pin and stretch for this area of flexors. And these flexors tend to really get tight and congeal in the pocket with the other muscles. This will help open up the femoral artery and nerve often in this area, because that's also where it crosses. So it's important that you pay attention to anything that's soft and pulsing. You don't want your hand on that. Okay, once we've done that, what I do is called some foot rocking. I place this foot into my abdominal cavity. It's great on my viscera. I hold across the retinaculum in the front, and I just start rocking. If I place the foot in one position, I'm affecting one half the gas drop. And if I turn the foot, I'm affecting the other half. But the thing that's really important to know is this hinge in the anterior retinaculum here needs to be released. So let your body weight just fall into it, rock it back and forth, and the proprioception will keep most of any discomfort down because proprioceptors travel 125 times faster than nociceptors, which are your pain receptors. This is also considered a lymphatic pump, so you can activate some lymphatic return doing just this work. If you want to improve on that, of course, you can work the nodes here in the angle margin, and you can possibly even heat the nodes behind the leg, then do this pump if you have a certain amount of drainage you're trying to get to occur. From there, we'll do, again, we're just doing this on one side. Just remember, anything I do to one side, you'll want to do to the other side. I'm going to bring this leg across and keep it straight. Here, I normally apply some ointment. And starting at the lateral malleolus, I'm just going to sculpt this tissue nice and slowly, especially trying to get some length in the peroneus longus. And I don't consider the muscle soften as I do the fascia, and that's a big thing in structural work. Go all the way down, around. And what you can do at this point is you can affect the coccyx. Again, we don't do chiropractic work, but remember there's a ligament on either side of that coccyx. If you bring it far enough over, reach back and find the sacrum, follow it until you hit the coccyx. Often, go to the far edge of it, put your finger between the coccyx and the sacrum, moving the leg around, it will pop up underneath your hand, kind of makes it stick out, and you'll be able to wedge your finger between the coccyx and the sacrum, affecting that ligament. And that's a nice way to release that component. Again, coming back then and finishing this leg, you want to do a lot of cross fiber work. Cross fiber release the muscles follows what's called Lange's lines. I learned there's Langer's lines, and then I found those Lange's lines. And that's the doctor figured out that partially extrudes 90 degrees to a muscle. So this 90-degree work will loosen this up very well. So there's a lot that you're working here. Don't get too complicated thinking about all the muscles. Think fascia. From there, you'll do the same thing. And again, I'm going to just switch to this leg. And we want to do the medial aspect. Starting out at the malleolus again. Always remember that the inner aspect of the knee can be very tender. The pes anseres is located right about here, and those are three muscles that form one area called pes anseres, which also means goose foot. And you want to work all the way down until you basically run into this ASIS. One of the more important places to work is that ASIS because it's a hub and so many muscles are affected by it. Then again, you can do this 90-degree work and loosen up all of the adductors. And there's a sleeve between the biceps femoris, one of the hamstrings, and the adductor magnus. And if you follow it down, you'll find that sleeve. It creates a little slot, and that's where you want to reach in and loosen, because the adductor magnus glues to the short head of the biceps femoris hamstring and forms what's called the fourth hamstring. And that can really give you some resistance in the hamstrings when that adhesion occurs. So you can work right in that slot, knowing that it's a very tender area to work in. Okay? Once you've done this, then you would take the person off of the bolster and always bring the arms down to the side, and they won't feel like they fell off. Slide this out. And then we're going to do a real simple little hip torque. One arm is up out of the way, the other one's going to be down here. Keep the legs slightly folded, and then slowly start bringing them straighter. And I'll reach up here and drag the laminar groove somewhere around T12 down toward the sacrum. And this is a very nice sacral distraction. And what you can ask them to do is to straighten your legs a little bit and increase that tension. And this is all about leverage, not really holding the weight so much as allowing it to fall onto your leg. So you see my hands are fairly free when I do this. Okay, and that will constitute the first part of this lower extremity. We're going to take a moment now and move into a prone position. So now, as you can see, we've laid her out in a prone position, and we've got the leg slightly bolstered with a pillow, make it more comfortable. We're going to do a single and double leg torque. So we reach right here, and we reach across, and always try not to grab people's quads. Brace across like this. Reach down to the costal margin around that xiphoid process and just pull that tissue. Also, the QL right here where you're hitting the ASIS, this is where you really want to affect the QL. If you look at most anatomy books, you think the QL is accessible through the back. It's not. If you really look at it correctly through some actual cadaver slides, you'll see it's a very deep muscle, and you can really only affect it right in here. So hook up underneath here to affect the QL. This is right on top of the ASIS, following the hip at the crest. Okay. And then you can add some leverage here. And same thing then, you can wind up doing this with a double leg torque, same thing. You can put your hand over it, reach down here and pull. And use your leg as a lever. And so this gives you a single and double leg torque. Okay? So after we've done the single and double leg torque, we're going to place a hip bolster underneath her. Ask her to rise up just enough. You can put this up underneath her. There you go. The two ASIS points hit the center of this bolster. This is a unique bolster in that it has a wood shim system in it, a set of wedges that allow the hips to float and roll back into position. And here I would change bolsters and start affecting some of the ligamental structure. I'll reach down to the iliolumbar ligament, follow the top of the crest, find L4, go down one notch to L5 and over, and you'll find a depression, and that's your iliolumbar ligament. Using the leg as a range of motion, simply rock into it and feel the area soften underneath your hand. From there, find the edge of the sacrum, and just placing your hand in and underneath the edge, follow that edge. You're just trying to loosen the ligamental attachments here. You come far enough, reach over and find the tip of the coccyx, same thing, the far edge from me, reaching into that little groove that's formed by the coccyx and the SI joint to affect that ligament. Continue to rock. And again, you'll be doing this on both sides. You can then go down to the ischotuberosity and simply friction underneath it to affect the hamstrings. And mark the ischotuberosity, tip of the coccyx, half the distance, and you'll be through the sacrotuberous ligament. If you find the edge of it and hook underneath it, you'll be able to affect the obturator internus for pelvic floor problems. And you can ask them to do something like a Kegel exercise, and you'll feel it tighten up underneath your hand. Then come over to this lateral edge, and rocking the leg you'll find a longitudinal groove, so to speak, and that's the quadratus femoris. Working that, and then come up around the trochanter. I'm going to reach across here so you can see that a little bit better. Moving the leg out, you'll find the trochanter comes into your hand, and simply grab around it, moving the leg, unlike cleaning a cue ball, or whatever you want to call it. That's what it kind of reminds me of, just cleaning this ball. All of the attachments. So you're not being real muscle specific here all the time. A lot of times you're working ligaments, sometimes you're working muscles, but the truth is we're always working fascia. Okay? And after we've done this around the trochanter, which we were doing on this side, we want to clamp right into this pocket here at the edge of the sacrum and affect the internal and external rotators. So if I come out, I push down with my left hand into the SI joint and up and down. So it's a seesaw effect right through the glutes, and that is affecting your internal and external rotation. Some people use their arms. I like using the edge of my hand. And this is how you can affect the piriformis, which is a very common problem. Really stretch it by pinning and stretching it. If you come from there, then you come down to the feet, and you can do what we call a little bit of foot sculpting. Okay? Starting out, do a little distraction on the foot. Capture it. Let your body weight come into it, move it around, and get that anterior retinaculum nice and loose. Again, I use my body here, and I'll add some stretch into the plantar fascia. And then I'll look at the foot and see what kind of distortions there are. You want a nice, smooth, symmetrical foot. You don't want a lot of twists in it. To get the twists out, simply sculpt it into place. You can use your elbow and your hand, and working from toes in toward the heel, just kind of move the tissue and sculpt it. And this takes a lot of practice using the heel as a lever, but you'll feel and be able to see the difference as it lays out nice and flat, and you have this good triangle that you're looking at. Now you can always opt to use these stones, and these stones can be heated at any time. I keep them heated in the crock pot, so the reflex action often helps, because some of these areas can be very tender. You want to work the gastrocs, and simply reach in, starting at the malleolus, and lift the gastroc, and try to go deep underneath the lateral edges to affect the muscles underneath, like the hallucis and the flexor digitorum, which often gives you those curl toe problems. Work through the center of the gastroc, all the way down until you find the connection of the hamstring at the back of the knee. With your thumbs, simply spread that connection and hold into it. And what I do is I rock my body back and forth with the foot inside my body. And I work my way all the way up until I get to the ischial tuberosity, which will be right there. So you're working this back and forth. And when I get to the ischial tuberosity, again, I have friction underneath it. And I'm using the leg to give me the torque. By twisting the leg, I'm actually stretching the muscle. And not everybody can do it that way. If you can't do it that way, then you just have to do it one side at a time, using the leg as your lever. Okay, and that pretty much covers this prone part of the regimen. Again, we've affected more of the ligaments in here. And the theory is affecting one ligament affects all the ligaments at some point through the body. It's a theory, we don't know. But we do know that on this bolster, that the body floats. As you can see, she's just kind of floating there. And it will have a tendency of lining the innominates up. You can also do what's called still pointing when you lie on something like this. It shuts down the cranial pulse because the osseous structure is locked into place. So from here we're going to move back into a sideline position. So here we have a sideline position, and what we're going to do is reach right into the laminar groove, starting around the iliolumbar ligament, compress the tissue inward so that it gives me some depth, and then pull it out. Again, push in and pull it out. So my fingers are pinning the tissue as I go deep next to the spine, and then it holds and allows me to pull this tissue right out of the laminar groove. And you can do this any way you want to, with your arm, your hand, just depends on how strong you are. You can stick your thumb in here and do that. I use this little pincer grip often so I can hold on to the area. But that's what you're trying to accomplish, is to clean out that laminar groove from basically T12 down to L5. At that point, you want to lengthen the body slightly. So we drop one leg back and reach right here, hooking my hip into hers, and simply some compression, and then move the tissue. So you want to lengthen this body line, this lateral body line, as it tends to be stuck in here. Okay. Now what she's going to do is roll to the opposite side. On that side for me. And like I say, I would normally do the same thing on the laminar groove. I would drop this off to lengthen the body line. So here I'm going to take this leg and cradle it in my hand, compress on top of the trochanter, put my body weight into it, and just kind of clean out that socket. And you can also reach down once you get your landmarks, find the pectineus, psoas, iliacus, and at each point, simply pull back, and you're doing a pretty good psoas stretch here, just like this. Just hold the position and feel the tension and walk all the way up across and around the crest. All the way to the ribs. And that gives you what you're looking for in that position. Next thing then is I'm going to drop this leg off. Just going to lean forward just a little bit like that. Put my body weight right next to the leg, reach up here and capture and hook the entire hip and just pull down. And now what she can do is push up into me a little bit with her leg and then release. And I'm placing my hand between her and the table so we don't jam her leg into the table, so we put it right down between to give it a little bit of support. Because the edge of the table can be hard, but you want to pull the entire hip. And you can use both hands and just pull this entire hip. Okay, and that's a really nice stretch for the QL for this entire area. Again, thinking fascia here, so I try not to name as many muscles. So I was trained in the muscle end of it, now it's all about fascia. Okay? And that pretty much covers your sideline position. Then we'll go back to a supine position. So here we are back in a supine position, and we're going to ask her to slide all the way over to the edge, placing basically half your buttocks off the table. Hold on to this knee for me, and keep this leg off. This is your standard Thomas test, this is called. You can check out the shortness in your flexors. You can see if the quadriceps are too short by how far forward the leg goes. You can see if the psoas is too tight by how high up this goes. When you push back, that brings us up. So basically that's what we're doing, is releasing this area. I'm going to place low pressure here and ask her to push her left foot up toward my hand just a little bit, low resistance, and after 7 seconds release, and then press again. And we'll do that several times. And this is a very effective way also to open up that SI joint. Okay? Get back to the middle of the table. So here's another way to affect that obturator internus. Now that's a fairly important muscle a lot of people never mess with because it affects the pelvic floor, and yet so many people have pain because of weak pelvic floors, distorted muscles, all kinds of scarring and surgeries, you name it. And it's a very effective way to reach this particular muscle, which is not something that is easy to reach. Now if you remember in the prone position, I accessed it, marking the coccyx and ischial tuberosity, and then hooked into it. We're going to do the same thing here. I'm going to find the ischial tuberosity, saying it's here somewhere. I'm going to go into it, reach around it, and hook up into it and laterally out toward me. And then she'll be able to do something like a Kegel exercise, which will tighten that muscle and tell me that I'm on it. So we'll bring this up to my shoulder, reach down and find my landmark, which is right there. Reach around it, you'll find a void, and as I move my finger coming this way, I can rock the leg back and forth and affect this muscle easier. Often this can be very painful in this area, so just rocking the leg back and forth or doing a little muscle energy technique, push against my hand, one way or the other will make it feel better. And you want this basically not to have any pain in this area. It's amazing how many people have pelvic pain or low back pain, and this is an area that can relieve that. Okay? So there are 2 ways to reach that particular muscle. This is the one I prefer. From here, you want to go into a leg scissor, and this is a rather unique movement that's very effective on bigger people. So small therapists can get a real effect on larger people using a leg scissor. To complicate things, remembering how to get into it. Cross the leg, and I'm going to be on this side. The straight leg is always in front of you, just like this. This leg will simply bend and come up toward my back. There we are. Then I'll reach around, and I want to push the tissue in the costal margin again. As I rock, I want to push from lateral to medial, bringing everything toward the center. So this gives a really nice stretch through all the glutes and the IT band on the opposite side, and you can adjust this simply by moving the leg. You can adjust it to get deeper and deeper into the rotators here. Okay, after we've done the leg scissor, cross the leg like so, and this is a figure 4 body torque. Got that today. I'm going to reach right here and hold down the ASIS. Ask them to take a deep breath and release, and as they do, we're just going to roll forward. And you can do that. You can also reach in here and hold around the crest and affect the ligaments such as the lumbar ligament. So it gives you a real nice leverage to do that. And then our last movement, again, all these will take a while to do slowly. I'm doing it pretty fast. This hand comes out of the way. The last move will be to bring the body back into this flexion, but this time we're going to add another dynamic to it. So her legs are on my leg, and I'm just kind of holding this up. I'm going to reach back here and capture the suboccipitals in my hand, reach right here and capture the sacrum, and as I slowly bring it together, I'll ask her to straighten her legs to tighten up the entire structure, and she'll feel the tension all the way up to her neck. And so as I'm pulling into the suboccipitals and pulling down the sacrum, I'm getting a real nice lengthening of the entire spinal ligament. And you can spend some time doing this and getting really good at it. So at the same time, you're loosening the ligament attaching up to the suboccipitals all the way down to the sacrum. Okay. And that basically covers our lower extremity. The lower extremity course works. You just have to take people through this work. If you do it, it works. If you take time to learn it, I think you'll be real satisfied with the results that you get. Again, anything doesn't feel right, don't do it. These are simply techniques put into a recipe that work for me. You can take some of the same techniques and shorten the recipe or lengthen it, add it to a full body construction if you want. In our structural full body work, this is part of what we do. So, again, this is for your edification, and hopefully it will work for you. Thank you. That's a good thing to get ahead.
And no glare. No big bright light.
Right.
So,
Okay, you want to record?
that's going to record, and we're going to record here. So,
Okay.
here we go.
Watching the clock. That's cute. What? My clock stopped. I'm watching the second thing, and it just did. And it just...
There it goes again.
It went?
Just started that.
And we'll keep going. That's what I love about being dub out. And 5, 4, 3, 2, and 1.